Welcome back to Midday Kentucky, everyone. Well, in 2016, more than 246,000 American women developed invasive breast cancer. That's 1 in 8 women. They will become part of more than 2.8 million people who are living with a history of breast cancer. With October being Breast Cancer Awareness Month, we wanted to welcome in one of our wonderful partners, Dr. Benjamin McQuaid from Clark Regional Medical Centre. Welcome to the show, my friend.
Thank you.
All month we're going to be having experts come on and break down all the information that we need to know, and also our viewers would like to know as well. So welcome to the show. We appreciate you coming in. And first of all, we want to tell everyone you're a radiologist.
That's correct.
Okay, so let's get straight into where we stand. We believe in America that Kentucky is in the top 8 when it comes to the state for breast cancer awareness. Is that correct?
Kentucky does have a very high rate of breast cancer. That's correct. And it's estimated nationwide that 1 in 8 women will develop breast cancer in their lifetime.
It's frightening, isn't it? And it can be prevented by doing screenings and mammograms and self-checks and things like that.
Screening mammograms can actually cure breast cancer if caught early.
Yeah.
So the main reason for screening mammograms is to detect breast cancer at a very, very early age when it can be treated successfully.
All right, doctor, let's just talk exactly what is a mammogram to begin with. For someone out there that's never had one, okay, and they really don't know what it is, talk to me about that.
A mammogram is a special type of X-ray image that is obtained of the breast. We take images in typically 2 different planes with a special mammogram unit, dedicated mammography technologists who are specially trained in acquisition of the images, assist with the exam.
Okay.
The breast is placed on a plate, and then there is a compression paddle that is directed from the top part and then also from the side part. And we typically do 2 views of each breast.
Okay. I'm probably throwing you a curveball here, and I don't mean to. Women who have breast implants, there's a common misconception that they think that they can't have a mammogram. Is that correct?
That is absolutely incorrect.
Thank you. I wanted to put that out there, everyone.
We do screening mammograms on women who have implants routinely.
Good. Thank you for clearing that up. Why is it important for women to get a screening mammogram? Because I haven't heard of this.
Screening mammograms are exams that are performed on women who basically have no breast symptoms or no breast problems.
Okay,
and
go on, sorry.
And the reason for screening is to detect breast cancers when they're extremely small, so they can be cured.
What are the recommended guidelines for screening mammograms?
Typically, the nationwide guidelines are mammograms beginning at the age of 40 and continuing every year.
Even if you have a family history of breast cancer?
That some women who are at higher risk need mammograms earlier than the age of 40.
Okay.
But someone who is at, quote, average risk, still very high, 1 in 8, should begin at the age of 40.
Okay, good information. What is the difference? These are great questions to be asking you. What is the difference between screening and a diagnostic mammogram?
Okay. Screening mammogram is done on women who have no breast complaints, no breast problems. Diagnostic mammograms are tailored to address certain issues that a woman or man may have, such as a palpable lump, dimpling of the skin, thickening of the skin, or nipple discharge.
Okay. I'm going to extend this interview just for a moment. My producers are saying to me that we've got to wrap, but I want to ask you one question while you're here. No one ever talks about men and breast cancer for them. Talk to me a little bit about that. What do men have to look for?
We know that the overwhelming majority of breast cancers occur in women.
Yeah.
However, men, and most of the statistics say that 1 in 100 to 1 in 200 men will develop breast cancer. We do not do screening mammograms on men. So it's important that if a man finds a lump, that it be evaluated. And this may catch you off guard a little bit, but we do mammograms on men.
Interesting. Interesting. I'd like to go deep into that at another time if we can, because I think it's really good information for a man to learn how to self-check as well. We appreciate you coming in.
Thank
Thanks
you.
for all the information. If you want to find out more information about Clark Regional Medical Centre, you know, there's all the information up there. Dr. Benjamin McQuaid as well. He is fantastic. He's good information. We appreciate you coming in as well. Hey, guess what, everyone? Winter is coming, and we're going to give you tips on how to winterizing your garden. Stick around, everyone. You're watching Midday Contract.